What would you do if your insurance wouldn't pay for life-changing treatment for you, or worse, your child? It's a reality for millions of patients, and it could happen to you. As a doctor, the question takes me back to one of my earliest days in medicine. Montel Williams has the story.
For patients, it can be a disaster. The news that their medical insurance claim is denied or that a life-changing procedure will not be covered. Every year, insurance companies initially reject at least 200 million claims. Sometimes the reasons are technical, like improper filing of paperwork. But at other times, the denial of coverage for doctor-prescribed treatments, drugs, or devices falls into a gray area. The doctor argues the treatment is critical, often a matter of life and death. The insurance company maintains the treatment is experimental, risky, medically unnecessary, or unproven. All around the country, doctors and patients are fighting what often looks like a battle between David and Goliath. Some desperate families even resort to crowdfunding when insurance refuses to pay. One woman even took her struggle on behalf of her daughter to YouTube.
If a doctor deems it medically necessary, who are they to go against the doctors? You legalize it with your big fancy words, but let me tell you, I am a mother who's fed up.
The stakes couldn't be higher, as Dr. Oz himself knows all too well.
I was a young surgeon, and I was called from another hospital in the area about a patient that was dying. He just had emergency heart surgery. And when he came over, to me, it was a pretty straightforward decision. He was critically ill, but he needed a new technology that was already FDA approved called an LVAD. It's a piggyback mechanical heart to allow him to survive long enough to get a heart transplant. And as I was about to open his chest to do this life-saving operation, we got a phone call, never forget it, and it was the insurance company. The insurance company representative on the phone said, we're not going to pay for this life-saving operation because even though it's FDA approved, it's not widely used, so it's an experiment. So now I'm in this incredible dilemma. I have my Hippocratic oath as a doctor that I'll always protect my patient, and I knew this device could save his life. And yet the insurance company, very loudly on the call with everyone to hear, is telling me I don't have the right to put it in. No one's going to pay for it. What would you do?
Whoa, well, what did you do?
What would you all do?
What? Put it in, do the surgery. What did you do, sir?
I put it in.
There you go.
And I'll tell you, I put it in because that's the oath I took when I finished medical school, and then I got sued by the insurance company.
What?
Because the insurance company said, and this is actually logical, it's crazy sounding, but it's logical. They said if you hadn't saved this man's life, he wouldn't have survived to need the transplant and cost us all that money. So you created an expense for us. And crazily, the better he did, the more I was on the hook.
Well, see, one of the things that people don't understand, and this is what I think this show is so important for and why I'm glad you're doing it, because people have to understand insurance companies don't look at you really as a patient. As much as you think they do, they don't. They look at a bottom line. It's a corporation. They have profits and they have losses. When they pay your insurance policy, when you look at their records at the end of the year, they put it under the loss column. Yeah. That's what they think of us, a loss, not the fact that you've been paying them all along to cover what you've asked them to cover.
And here's the part that's most perplexing. There are some technologies that are FDA approved, but they're not widely used. They're not standard procedure. And it's in the best interest, of course, of people to think that they're not widely used, because that way they're not widely paid for. And that's the slippery slope, my friends. That's when the patient and the doctor have to team up to fight back. So I want you to take a look at the story of a young woman caught between her insurance company and a life-saving treatment.
At 27 years old, Lindsay was happily engaged to the love of her life and excited to be in the middle of her surgical residency when she was given a devastating diagnosis: liver cancer. Lindsay was originally treated with chemotherapy, but her cancer metastasized. So her current oncologist wants her to try a different approach: proton therapy. Proton therapy is much more focused than traditional radiation and decreases radiation exposure to surrounding organs, which in turn decreases Lindsay's risk of developing cancer later in life. But Lindsay's insurance company is denying her claim, preventing her from receiving a potentially life-saving procedure. Now, just 2 weeks away from her wedding, Lindsay finds herself in a fight of her life with her insurance company for the treatment she desperately needs.
Linsy is here with her fiance, Ernest. Thank you for being here. I know it's a busy time. You're getting married.
Yes, 10 days.
10 days. Great. How you feeling?
So overall, it's a little overwhelming right now in my life. We're getting married in 10 days, so that's a little overwhelming. I'm in residency right now, and that's definitely overwhelming. And in addition, I'm dealing with cancer, so between everything, it's just an overwhelming time in my life.
How difficult was it going through the chemotherapy for this diagnosis?
That was one of the hardest things I've ever done, for sure. It's just a difficult time in your life.
Take your time.
But I was fortunate in having a lot of great friends, great family, a lot of support from other people. But it's a very difficult time, for sure.
Doc, you know, it's very interesting. Linsy said it quickly and people don't think caught on it. She's in residency. She's training to be a doctor. So when a doctor finds out that a doctor is ill and has to go through it, first off, I know you're going to survive this, so I would love to have you as my doctor if it ever happens to me.
It goes for all of us.
But you understand a little bit more about treatment, about insurance, and about things like that.
Yes.
And Linsy, again, Montel mentioned, and I'm going to highlight it, you're a doctor. So if a patient came to you and needed a treatment you knew they'd benefit from, and it was declined by an insurance company, how would you react?
I would be angry. I would be angry for sure. It makes you fight more for your patients. Every time you walk into a room and you're with a patient and something like that has occurred, it just makes you angry.
You know, but see, here's the problem. The treatment that she could have made available to her is one that's never been tested on her type of cancer because her cancer is so rare. Sure. So they'll never have an opportunity to test it, but instead they're saying, nah, since we've never used it on a person like her before, nah, let her just suffer through the other kinds.
So let me, if I can, I just want to make sure we're all on the same page here what we're dealing with. If a better technology exists, right, a patient should have the right to receive it. That's what we all think up here, right? I think everyone in this audience feels that way. Proton therapy is FDA approved, and it's important for Linsy to get it for her treatment because we can stop a growth that won't kill you directly except over time. So if this therapy, without damaging surrounding tissues, can take care of this one little problem, we can take your life to decades more of fruitful existence. You can make family, and who knows what cures we'll find in the future. So this is, I think, especially important, Montel, for a rare problem like you have, because we know enough to know it's really going to help you. So Montel and my med unit, well, they took on Linsy's case. I want you to find out what happened when we come back. We are back with Linsy and her fiancé, Ernest, who are just days away from their wedding, but they're busy fighting their insurance company for a cutting-edge cancer treatment that could prolong Linsy's life. And Linsy's Dr. Alan Meek is here. You've been a radiation specialist for years. I just want to hear from an expert. Do you think this therapy will make a difference in your patient's life, and how compare it to traditional radiation?
Yes, definitely. Linsy has a very rare kind of liver tumor that has spread to her spine at about the level of the shoulder blades. And if this tumor continues to grow in that location, eventually she will be paralyzed from that level downward. So we have to do something about that. Radiation is one option, and proton beam is the most targeted form of radiation. So this is the best treatment for her.
It sounds to me, and as a doctor you know this, that this is clearly what should happen. So Montel Williams and my medical unit have been taking on the case with your insurance company. Let's take a look at what happened.
Please leave a message and I'll call you back as soon as I can.
On our first attempt reaching out to Linsy's insurance provider, our medical team found it difficult to get through and difficult to get answers. We finally reached an insurance company physician. We were just wondering if, there's something that we can do to see if we can convince insurance company to change their mind about covering this treatment. The oncologist that we've been talking to has stated that he thinks that because of where it's metastasized near her spine, that the other form of radiation might not be the best course of action because the proton beam could be a little bit more direct, not interfering with surrounding tissue, and possibly fare better in a long-term prognosis.
We want to do what is ever going to be best for her, but we need to administer the benefit plan that she has, and the benefit plan says we can't cover procedures that are experimental, investigational, or unproven, and there's just a lack of data showing that proton beam is useful for this kind of tumor.
But that's the exact problem. It's a rare type of tumor, so it's very difficult to gather evidence for this.
everybody we've spoken to so far has said IMRT or conventional radiotherapy is the appropriate treatment to use. It's hard for us to say it's anything other than an unproven technology for the treatment of her particular condition.
Okay, so just for the record, you're still denying Lindsay's claim?
The denial still stands, right.
So despite our efforts, including that call, Lindsay's request is still denied until she goes through an appeal process. Unfortunately, you all have lived this. The responsibility falls ultimately to the patient to navigate these waters, and that takes a lot of time. And time is not our ally when we're racing cancer. And frankly, I think, unfortunately, and this happens a lot, red tape and medicine don't mix. No. And we are forcing them into the same bucket. I know that's frustrating. But I do believe, even though the insurance companies pushing back, that we have a solution for you. We have found an anonymous donor who has agreed kindly to pay for all the proton therapy treatments at the Provision Center for Proton Therapy. I wish you the best of luck. Keep up, keep fighting. Thank you very much. We found your story. You gonna send us pictures for the wedding?
We'll do.
All right. Up next, parents who took on the insurance company and they won.
Yeah.
We're back asking the question, what would you do if insurance won't pay for life-changing treatment for you or your child? Well, one mother refused to take no for an answer. Take a look.
Our daughter Aria was born with multiple congenital heart defects, and her condition was very serious.
The good news was that the medical technology existed that could save her life.
When Aria was about 1 year old, we began making arrangements for her open heart surgery, and then just a few days before the operation was scheduled, the insurance company informed us they wouldn't cover the procedure.
They said that both the doctor and the facility were out of network. This was really unexpected because they didn't let us know that in the months leading up to the operation.
We were devastated, of course, but we knew we wouldn't give in. This was the doctor in the hospital that could save our daughter's life. We knew it, and we were ready to fight for her life.
Bridget, Johan, and Aria are here with Montel. And it has been 4 months since Aria's surgery. So how's she doing? How's she changed?
She's doing really good. She has changed quite a bit in her ability to be running around and vocally everything.
I can see she's enthralled. Was she as beautiful before the operation as she is now?
Yes.
And did she still have her little doggy here before the operation?
That's your doggy? Yeah.
All right. Bridget, why was it so important for you to be here today? And why was it important for Aria to see the heart surgeon that you had picked out?
We felt that they were the ones that knew her, knew all of her conditions, and were best suited to handle her situation.
There are lots of reasons that I find parents and patients pick one doctor over another. They get along better, they feel the quality's better, the experience they feel more comfortable with. All these, by the way, are important issues. But you're just one mom, one little old mom, fighting against this big insurance company.
Yes.
What gave you the belief that you'd even make a dent into this process?
Well, I am pretty ornery, and I told them when they told us no, that they didn't know who they were messing with, that I was pretty fierce, and that I wouldn't stop until we got what we needed. I, in fact, said over my dead body, would we go to the other surgeon or hospital that had never seen her?
And then, you know, what people have to understand again, the insurance company sends you to a doctor who's a specialist to do all the workup. Then a week or two before the surgery, you say, oh, by the way, you're not going to let him, he's not going to operate. I'm going to take you over to guy B that you've never seen before, your child has no relationship with at all, and this is the guy who's going to do the surgery, and I don't know, we think he's as good. You can't do that in the middle of this. And it takes this kind of voracious mom to say, no, enough, you're not going to do this. And the fact that she said it made them go, wait a minute, because the squeaky wheel does get all the grease, period.
So they finally relent.
No, they didn't.
They didn't.
No.
And what happened?
We had to keep fighting. So
What was your strategy? How did you get them to finally say, we give up?
Well, our strategy was I told them I know lots of people. I'm a hairdresser, so
I whisper in everybody's ear.
But see, I gotta say, I'm going to say, that's true. We all have a lot of power. We don't think about it, but we do.
And I went and found their Facebook page was the first thing because I couldn't sleep the night that we were told no. And I tagged every single one of my friends and one of my clients and wrote across their whole page. They shut it down for about 48 hours. And I told them by tomorrow we will have a media blitz going. And by 12 o'clock the next day, we had every news channel in town at our house.
Now, I understand you also called, that every state has an office that sort of monitors this. You did everything.
So we had to keep appealing, and that was the process. And then we appealed to the California Medical State Board review, and they stated that it had to be with our original plan.
And Johan, what happened when you found out that your wife had finally won?
I was actually driving, and I had to pull over on the side of the road because it was such a tremendous experience. It was stressful. We did so many different things. I broke down. I just broke down and started praying and called just about everybody I could think of. So it was tremendous.
Well, Johan, Bridget, congratulations. Aria, stay beautiful. Give them a hard time now.
And you
pay them back.
The main point, though, they didn't give up. You didn't stop. You didn't take no. You kept digging and kept fighting. And that's what we're all supposed to do for our loved ones, our family members, our children, to fight. Fight to the last drop.
Thank you for fighting for all of us, Montel. I appreciate it. We'll be right back. Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.